Hello.
Hey, Dr. Porsche, how are you? Can you hear me? Dr. Porsche, can you hear me?
This one with the next one. Yeah. No, they'll probably take you to the next one. I'll show you. Show you like it on. Excuse me. Oh my God. Hey. Good. How you doing?
There you go.
Hi, Malin. Hey, you're going up? Just in time.
Recording in progress.
Malin, are we ready to start?
Dr. Porch, if you could just give me like 1 minute, I'll be ready. I apologize. We're having a little technical difficulty. So if I could just have 1 minute, we'll be ready to start. Thank you so much.
No problem. For those of you who just joined us, we're waiting. They're having a little technical difficulty. And once they're ready, they'll let us know. Let's begin.
All right, Dr. Porch, we are ready to begin. I apologize for the delay. I'll pass it over to you to get us started this morning.
All right, good. Thank you. Thank you everyone for attending our May HealthWorks Commission meeting. A few items to keep in mind for this virtual meeting. This meeting is being recorded, as you can see on the screen. At the beginning of the meeting, we will take, at the end of the meeting, we will take public comments. All public comments can also be added into the chat feature here on the Zoom. Please indicate if you would like to speak at the end of the meeting in your comments, and we're going to try to keep record of that. Also, if you have extended comments, they can also be mailed at webinar@laregents.edu. And that would be, again, webinar@laregents.edu. And that's really if you have extended comments you would like to make and get into the record. So to begin our meeting, I will ask Malin Baker to do a roll call for us. Malin?
Thank you, Dr. Porch. Claire Stevenson, Christina Costanza. I think I saw her.
Here.
Kathy Baldridge. I think I see her. Kathy, are you there?
I'm here. I'm having internet issues today too, so it's going in and out.
Okay, thank you. Bronwyn Dole.
Here.
And I apologize, Dr. Stover, if you could help me with your first name.
First name is Anissa, last name is Taylor.
To make sure I pronounce that correct.
Brown
Thank you.
has not adjusted to.
Sharon Dunn,
I'm here.
Wes Hadaway, Jawanda Gibbons,
Here.
Janine Kahn,
Here.
Tina Holland, Shaquita Johnson, Reagan LeBlanc, Karen Lyon, Representative Chris Turner. I think we have a designee present for Representative Turner. If you could share out your name. If your audio is not working, if you could utilize that chat feature, please. Christy Anderson,
Here.
Christy Marceau, Dr. Ram Pagari, Dr. Porsche,
Here.
Paul Salas,
Here.
Kelly Taylor White,
Here.
Jeffrey Williams, and Lisa Broussard.
Great.
I'm here. Thank you.
We have a quorum. I'm also going to be following up. Kelly let us know potentially for any open meeting law changes concerning whether or not our motions will be in effect. We'll proceed as is, as we already have planned, but I will be following up to make sure we're in line. We're also live streaming as well. Please feel free to utilize the chat feature throughout for any public comments and longer public comments via email. Dr. Porsche, I'll pass it back to you.
Yeah, thanks. And in the chat so far, we have Rebecca Daughtry is here for Representative Turner, and Lynn Ansardi is also with us from the LPN board. Next, I'd like to call for a motion to approve the February 15, 2022 meeting minutes. Is there a motion to approve the minutes?
Moved.
Dr.
Motion by Dr. Dunn. A second?
I'll second this, Paul.
Second by Paul Salas. Okay. Any discussion? Any opposition? Hearing none, we'll consider those the minutes as adopted as circulated. So the motion passes. The next item on our agenda is to prioritize recommendations, which are a result of the subcommittee that was formed in February by our commission. As you can recall, in February, we discussed two reports, the Nursing Supply and Demand Council report, as well as the Dr. Ali Busamante's Health Workforce Landscape report. These reports provided us with baseline data related to the supply and demand and informed a wide variety of 20 plus recommendations. After the February meeting, the recommendations and priority areas of work was completed by a group. The group consisted of Dr. Browen Doyle, Dr. Sharon Dunn, Dr. Karen Lyon, Dr. Amy Hall, Ms. Chiquetta Johnson, Lynn Ansardi, and Christina Castananza. This group met 3 times and discussed all of the recommendations and prioritized them in the 6 priority recommendations for the commission. These recommendations will anchor the work of the HealthWorks Commission in the coming year. And we'll go over those. Are you going to display them on the screen for us, Malin?
Just one moment, Dr. Porsche. Yes, I will in just a moment. I apologize.
Okay, not a problem. I'll wait for you and then I'll go over the goals. Okay, so first up we have is recommendation 1 is advocacy for funding of academic practice partnerships to leverage public and private investments designed to encourage innovation, increase the capacity of healthcare programs, and address regional healthcare workforce needs. Some specifics here in this area is regional consortia of academic practice stakeholders to prioritize local health needs for the provider pipeline and collaborate on solutions to meeting those needs. And the other specific is the application that would outline standards and criteria established in order to distribute funding to all regions, and then begin to invite letters of intent and then have proposals submitted in full. So the next recommendation, we can go over the next recommendation. And that is goal 2 is to address nurse faculty salary discrepancies or disparities, which are among the most significant barriers to attracting nurse faculty in Louisiana. And the specifics for that one is basically conduct a review of Louisiana nurse faculty salaries, as well as state legislation specific to nurse faculty salaries. Lynn, would you like to progress to the second, now to the third goal or recommendation? I think we may be having a little AV difficulty there. Okay, I'll continue on to the third recommendation or goal, and that is to support funding opportunities. And when we talk about funding opportunities, we're specifically speaking of things like grants, scholarships, tuition reduction programs, etc., so that they can decrease tuition costs for nursing students, especially those from diverse backgrounds. And when we look at diverse backgrounds, we'd be considering social determinants of health for those diverse backgrounds. And the specifics for that goal is basically an exploration of scholarship programs specifically for students who already have a bachelor's degree and who do not qualify for financial aid. We discussed this and identified that as one specific group that has some disparities in funding. Goal 4, or recommendation 4, was to reinstate the stipend program previously administered by the Board of Regents, which in the previously had provided a maximum of $40,000 to nurses who agreed to pursue an academic graduate degree, and that could be either a master's or a doctorate degree in nursing, and who commit to teaching an RN registered nurse program 1 year for each $10,000 received in support. And basically the specifics, we're working with the subcommittee to review various program structures and to determine the changes that would be needed to a new program. Goal 5, our recommendation 5, would be to standardize and streamline roles and regulatory requirements for healthcare occupations. And what was discussed here is basically a summit bringing together nursing stakeholders to outline and articulate the gaps between and within academia and practice and optimize clinical learning experiences for future nurses in Louisiana. And then the 6th recommendation or goal, and the final one, is to expand capitation funds that provide funding to post-secondary education institutions to increase the capacity of RN and LPN programs in Louisiana. And the consideration is that specifically that this would allow additional applications into the nurse capitation program. I'll pause here after hearing the 6 recommendations and goals that were set out for us and see if we have any comments from our HealthWorks Commission members. Anyone have any questions or comments from the work group in the priority areas that they've identified?
Dr. Porsche, this is Bronwyn Doyle. The only thing I would say is that I think the recommendations, of course, I was on this work group, but they align well with the recommendations of the Nursing Supply and Demand Council. And they address both the faculty shortage and how we can try to mitigate that, as well as, supporting students in their quest to become nurses, as well as the programs support for them, specifically with capitation, to expand. So of course, I definitely am in favor of advancing these recommendations.
Thank you, Dr. Doyle. All right. I think, Malin, we have a question in the chat asking for you to promote Catherine Baldrige into the meeting again. All right, so are we ready to go on to the next agenda item, which is the legislative session 2022 updates?
Dr. Porsche,
Yes.
if you don't mind, I have one quick update.
Yes.
And I apologize for my tech delays. I did receive a question asking clarity over today's meeting and whether or not we could conduct business virtually. I am going to follow up to determine the exact open meeting. I apologize. I was not aware of to prevent virtually. As y'all remember, when we last met in February, the preference of the group was to continue to convene virtually at this May meeting. And so I wanted to honor that. I will follow up. For today's purposes, we'll keep everything for informational, but we'll hold off on any motions today. So thank you for your patience, and I apologize for those tech delays.
Okay. Should we reconsider the motion that we made on the approval of the minutes?
Yes, we'll just hold off, or we'll just hold off for any of those motions. But thank you for that. I appreciate that clarity.
Thank you. I appreciate it. All right. Now, are we ready to move on to legislative session 2022? So the next item on the agenda is to share some legislative session update, and particularly focusing on those updates that really will have some impact possibly on the commission's work. And this, remember, the session will be, the legislative session will continue until June the 6th. We hope that this session will continue to result in continued capitation funding and additional funding for the HEROES Fund. There are two specific bills that we want to just call your attention to for the commission. The first one is basically Senate Bill 194, and that bill is by Senator Sharon Hewitt. And this bill would add the president of the Louisiana State Nurses Association or their designee to the HealthWorks Commission. And this bill is currently pending, I think, House final passage. And then the second bill is House Bill 226. And this bill is by Representative Chris Turner. And I think we have a representative here with us that could possibly give us some update on this bill. But this bill would create the Louisiana Healthcare Workforce Education and Training Council. And at this point, we'll pause and let Mr. Turner's representative give us any specifics they would like to discuss on this bill. Rebecca, would you like to speak to this? Okay, so Rebecca's audio is not working, so sorry, no update on House Bill 226 today. And then another bill that I was just made notice to call out is House Bill 155. It's for a study group to evaluate options and make recommendations for reforming health workforce training and the development in the state. And this has also been authored by Representative Turner. And I don't have any other details on this one at this time. If there's anything that you'd like to update us on, Rebecca, you can put a comment in the chat on this one also. Okay, are there any additional legislative updates by any commission members that you'd like to share or bring up for discussion?
Dr. Porsche, I just wanted to mention a Senate resolution, and that is, let's see what the number is. Senate Resolution 129 by Senator Hewitt. This resolution is requesting that the Nursing Supply and Demand Council study and make recommendations to improve statewide nurse retention in response to the nursing workforce shortage. This was, we actually have a work group working on some recommendations related to nursing retention, so this will certainly formalize that. And so assuming that this passes, this will be one of our goals for this 2022 year.
Thanks for that update. Any other commissioners have any other bills or updates you'd like to provide us with? And Dr. Birch has also pointed out that nurse well-being is also included. All right, any other updates? I don't want to rush us along. Also, we received a note from Representative Turner's office saying that they can prepare an update that they'll send out to us via email on the two bills that we discussed, the House Bill 226 and also Bill 155. So if there's no other updates or information on the legislative session, the next item on today's agenda is the Nurse and Allied Health Capitation updates. And I'll ask Malin Baker, our Assistant Commissioner for Strategic Planning and Student Success at the Regents, to present for us. Malin?
Thank you, Dr. Porsche. We'll go on to the next slide here. It's going to be a brief update since we are going to be kind of following up to determine, the hope is for us to kind of get ready as we wrap up this fiscal year, making plans for next fiscal year. And so I just wanted to provide an update of potentially where we could be, acknowledging that a lot of this will be dependent upon the end of session as well as legislative appropriation. So if we go to the next slide here, this is just a really quick overview of really potentially all of the funding that will be available in fiscal year 23. So in fiscal year 22, the Hero Fund, we have a remaining balance of around 4.2 million. There is tentatively an additional 4 million from the Hero Fund for fiscal year 23, acknowledging that this is a multi-year fund. And then, as we mentioned in February, 3.6 million for fiscal year 23 from State General Fund that's been added to Regents' base for capitation. And so in total, at the next slide, you'll see here, the Commission for Healthcare related initiatives around 11.8 million total, and acknowledging that the 3.6 in the State General Fund will be for that specific fiscal year, and then everything else as it relates to the Hero Fund is a multi-year plan. So if we go to the next slide here, you'll notice this is kind of a tentative breakdown. So taking the information from the subcommittee that has been convening, as well as our previous discussions as it relates to Hero Fund, this is the proposed breakdown for future funding spending. I'm just giving a breakdown of percentages, and the reason for percentages versus those numbers is right now we're kind of in the middle of figuring out and formulating, working with the institutions based off of applications specific to programs like nurse capitation and allied health capitation. So we could potentially utilize the funding. Around 41% would be going to nurse capitation, around 18% to allied health, and then 30% going and speaking to the recommendation of that subcommittee specific to regional academic practice partnerships. And so again, acknowledging that today, just sharing this for informational purposes. When we come back again, I'll be asking for a motion to approve. But the benefit of today is this allows you the opportunity to reflect and review. One of the things that we would like to do specific to the regional academic practice partnerships that Dr. Porsche was mentioning earlier in the presentation is creating a subcommittee to develop really what that grant could look like and how we can be innovative and flexible working with our institutions as well as those providers in the region to create a grant program, if you will. And so that is kind of the tentative plans for now. Before I kind of move on to any slides, I want to pause for any questions or feedback to this proposal Again, it's rooted in kind of the recommendations based off of the subcommittee that Dr. Port shared out earlier in the meeting. So I wanted to pause there for any questions or feedback to this plan.
Any questions? And so right now we're just accepting this as a report only, correct?
Yep, just a report and update. Okay. Well, if there are no questions, we will be coming back to this with working to develop a subcommittee to really inform what those academic practice partnerships. I know we have a few of our colleagues here who have participated in the nurse capitation program previously. We'll be working to continue that program. We'll also be looking to review and create any programmatic changes to the nurse capitation program as we also work to develop the regional academic partnership grants. And so acknowledging that there's a good bit of work to be done if this money is appropriated. And so we'll be definitely working with our already existing groups specific for capitation to get their feedback, but then also working to form another group specific to regional academic practice partnerships.
All right, thanks. Are you ready for me to move on?
Yeah, quiet group today. I'm like,
Yeah.
We'll move on to the next two slides, and you can go over and skip over that one, and we'll transition here into organizational updates.
All right, so first we'll have, for the first one of our reports we have from our work of our councils is the Simulation Medical Training and Education Council of Louisiana. And I asked Dr. Lisa Broussard, chair of this council, Simulation Council, to give us a report. Dr. Broussard?
Thank you, Dr. Porsche. If you recall, we had a significant amount of funding from the HealthWorks Commission last year. And so the commission awarded $50,000 to the Sim Council for the Expo, $32,000 for Camp Fast Forward, which is a summer camp for middle school kids that is going to be administered by two of our state AHEC agencies, and then $22,750 for a certification course for those that are interested in becoming certified as simulation educators or simulation operations specialists. So to provide a review and a report of that, the Simulation Expo was held April 29th here on the campus of UL Lafayette. It was really went well. We had about right at 250 participants. We had 16 vendors. We had two keynote speakers, nationally recognized simulation experts, one from the East Coast and one from the West Coast. And then the presenters through the day were simulation experts from throughout the state. Thanks to the generous funding by the HealthWorks Commission, we were able to give a small stipend to all of our presenters. Of course, we had a lot of expenses incurred as throughout the day, but it really went well, and the feedback was really positive. We had represented, our attendees were from across the state. We had people from the community colleges, from the universities. We had an interdisciplinary crowd, and it truly was a great day. And I think that, those who attended can say that they really felt like the money that we were awarded from the HealthWorks Commission was well spent. Plans are underway from the AHEC for their Camp Fast Forward. They have, I think McNeese is going to be a site, and SLCC is going to be a site so far, and they're really finishing that up as the school year winds down in the middle schools to secure those participants. And I've been in touch with those people, and they're moving along. The certification course is scheduled for June. It's going to be a virtual certification course, but it is a live course. So it's a one-day course, and people are registering for that at the present time. So that is all I have to report, but we really appreciate the generosity of the commission.
Thanks, Dr. Broussard. Yeah, I did also receive feedback. That was a great day. Any questions from the commissioners for Dr. Broussard? Okay, next we'll ask Dr. Browen Doyle, chair of our Nursing Supply and Demand Council, to give us an update on their work.
Thank you, Dr. Porsche. Honestly, this is going to be very brief because we have not met yet this year. We have a meeting. We're planning to schedule a meeting in mid-July. The only thing I shared already about the Senate resolution that we think will be making it through. The other thing I'll mention is that we are recrafting the annual report and how that will look a little different in the sense that we're going to pull together the supply education, the supply in terms of workforce, and the demand by the particular roles, so by RN, APRN, and so forth, so that it tells a little better story in each of those areas, as well as providing some kind of a narrative discussion section for each of those to try to not just give the data out, but also try to explain it. And then hopefully that discussion will lead to some robust recommendations as well. So we are also planning in the new report to provide 5-year trended data as opposed to just year over year, again, to provide better context for the data. So that is the only update as of now from nursing supply and demand.
Thank you. Any questions? So something new that we would like to introduce to the HealthWorks Commission is a recently formed Louisiana Interprofessional Consortium. The mission of this consortium, their statement was shared in advance of today's meeting. To present on the recently informed consortium, I think we have Dr. Tina Ganaldo. I don't see her on here, but maybe we can promote her from the audience if she's there. She's the director of the Center for IPE and Collaborative Practice at LSU Health New Orleans. Dr. Ganaldo, are you with us? Yes. Welcome, Dr.
Everyone
Ganaldo.
hear me now?
Yes, we can hear you.
Okay, perfect. Hi, everyone. Thanks for having us here at the HealthWorks Commission meeting. And so, first of all, our leadership team is larger than just myself. We represent the Louisiana Interprofessional Consortium, and we would like to thank the HealthWorks Commission for providing us this opportunity to increase awareness about interprofessional education and collaborative practice. And so for those of you who have not heard the term interprofessional education, or as we simplify it as IPE, interprofessional education starts in the academic journey, and it prepares our health professional students to learn how to work collaboratively in teams. I think the collaboration to work in teams is an expectation on the practice side, but it's similar to anatomy and physiology. We have to teach our future healthcare workforce how to work in teams so that they can successfully work in teams on the clinical side. So we know from the research that this education is absolutely necessary and foundational to improving health outcomes. So in the US, just a little bit of back history, the Interprofessional Education Collaborative, it's known as IPEC, first published their first report actually in 2011, so a little over 11 years ago. This report established 4 core competencies for interprofessional practice. I think this national support was really critical to advancing interprofessional work. So over the past 11 years, the support of interprofessional education has grown. So after 2011, we've now seen 23 health profession accreditor organizations include interprofessional education in their standards or guidance. And then we know that there's still 2 more in that group that plan to include interprofessional education in the future with their revisions. So we know that interprofessional education and practice positively impacts patients, clients, and community outcomes. But we also see a benefit, and this is all from the research, to health professionals and health organizations. And so some of those benefits that have been recorded include employee satisfaction, increased employee retention, decreased burnout or disengagement. And so in your packet today, like Dr. Porsche alluded to, is a document that includes some information about our consortium. And I'll tell you a little bit about our consortium in just a second. But we believe that the vision and the mission that we put forth in that document aligns well with the purpose of the HealthWorks Commission. And primarily it's because it's the word collaboration existed for both units. So just a little bit of history, and it's not much of a history about the Louisiana Interprofessional Consortium, but we developed just in December of 2021 through a grassroots gathering. We invited all higher education institutions, 24 attended. After that meeting, we had 17 institutions that indicated they wanted to stay engaged. And of those 17 institutions, 8 of those institutions have leadership representation. And so just to let you know who is engaged at the leadership role, we still have a lot of work to do in defining our leadership. But we have one community college. I think it's a great diversity before I start giving the specifics. But we have one community college, one health sciences center, 6 undergraduate, graduate institutions. We have 2 HBCUs. We have 2 private, 6 public. We have 7 professions that are represented on our leadership team, which I think is very important and foundational to interprofessional practice. Athletic training, medical laboratory scientists, nursing, pharmacy, physical therapy, public health, and radiologic technology. Our leadership represents 4 major regions of the state, so Central, Northwest, Southeast, and Southwest. And we have 4 Louisiana college systems engaged in our leadership. This type of consortium that we're looking for in terms of at the state level, it's not new. And so there are at least 15 other state or regional interprofessional consortiums that exist in the United States. Some that are probably maybe familiar to some. Tennessee has one for their state. The Midwest has come together to develop one, so a couple of states. Texas has one to our west, and then they have the Big Ten IPE Academic Alliance. And so this is not something new, but it is, like I said, since 2011 growing. And so our ask today, I think, is quite simple, but it might not be as simple to the commission, but our ask is to recognize Louisiana Interprofessional Consortium as a collaborator to the HealthWorks Commission, something similar to what we just heard from the simulation and the supply and demand councils. So with that being said, I hope I gave a good enough overview of interprofessional education and collaborative practice. And I want to thank you guys for your time and answer any questions that you might have.
Thank you, Dr. Ganaldo. Are there any commissioners who have questions for Dr. Ganaldo? Dr. Dunn.
Tina, welcome to the commission. It's nice to see you. How does an institution go about joining the consortium, the collaborative?
So thank you, Dr. Dunn, for that question. So when we had the initial meeting back in December of 2021, we followed back up in early February and asked all those institutions that attended if they were interested in engaging and just like kind of being a member of the consortium, or did they want to have a role at the leadership level in guiding this consortium. And so it was really just open. I heard back from, it was a simple email, and people responded yes or no, or we'll wait, right? And so that's how we did our initial ask. Yeah, is that enough information?
I think we would probably have some interested, at least programs from LSU Health Shreveport, and I know we're not represented yet. So if you send me some information, we have a committee dedicated to this work, and I'd like to get that information to them.
Okay, perfect, Dr. Dunn. They are, so they are on the list of being members.
Okay,
but
awesome.
I didn't have anyone that stepped up from Shreveport. If you want to encourage that, that'd be great for the leadership. But yes.
I think Dr. Dunn's on it. Any other questions from the commissioners for Dr. Ganaldo? So if hearing no other questions, we will take this under advisement. And I think when we have another meeting, we'll put this on the agenda, Dr. Ganaldo, to see if we can request a formal motion to recognize this as an official group that could report out at the HealthWorks Commission. So,
perfect. We appreciate it.
Great thing.
Thank you.
All right. And so at this time, I'd like to thank Drs. Broussard, Doyle, and Ganaldo for giving us these updates that were provided today to the commission. Are there any other organizational announcements for the commission? All right, hearing none, Malin, I'll ask you to let me know if there's any public comments that we need to address.
Dr. Porsche, there are no public comments at this time.
Okay. All right, hearing that there's no public comments, our next meeting is scheduled for September the 14th, 2022 at 10 a.m. I think at this time it's been suggested that we do virtual meetings, but I guess, Malin, if we need to revisit that, we can go ahead and revisit that.
Yes, I'll be following up. We'll most likely be in person next time. Absolutely.
Thank you. And then hearing no further comments or announcement, I'll ask for a motion to adjourn this meeting.
So moved, Dr. Porsche.
There's a motion by Dr. Doyle,
Seconded.
second by Janine Khan. So, all right, any further discussion? Any objections? All right, hearing none, the meeting's adjourned, and we've had a very short meeting but productive one with lots of updates today. So thank y'all very much for attending. Have a good day.